Hi there, I'm Jennifer Reed from 92.5 XTU, and I have the distinguished company from Cooper. We have Dr. Jose Trani is here. He's a vascular surgeon at Cooper University Healthcare, and he's going to be answering some questions that you guys have been submitting to us. How you doing?
Not too bad. Thank you for having me today.
Thank you so much for coming in. And this is quite a topic. I'm familiar with this topic, being of the female persuasion here. One of the questions submitted is, what causes varicose veins?
Okay. So varicose veins are actually one of the more common disease processes that we see. It affects about 25 million people in the United States. And the cause, you can think of it as a buildup of pressure inside of the veins, which are responsible for carrying blood from your organs or your extremities back up to the heart. So as that blood collects in those veins, they continue to bulge or expand, and that produces the varicose veins that people tend to see on their legs.
Which is probably why pregnant women, it seems like you hear about that a lot with women after they've given birth.
Absolutely. So in that situation, as the fetus grows, you have pressure inside of the pelvis, and so the veins that are coming from the legs run through the pelvis. They see additional pressure, and that pressure blocks the blood from efficiently leaving the legs. And over time, the smaller accessory veins start to absorb that extra blood, and they produce the varicose veins.
Okay, and I've got another question here from one of our viewers. They said that they've heard that an enlarged prostate can also contribute to varicose veins. Is that true?
So, while I just mentioned that the fetus in the pelvis will compress those veins, typically the enlarged prostates don't have enough mass to compress the veins, so I think that is not going to be a true statement.
Oh, okay. Well, they'll be glad to hear that, I'm sure. All right. And another question, are there risk factors for varicose veins? This is such a great question.
Absolutely. So, and this is one of the more common questions that I get in my clinic as well. One of the main risk factors for varicose veins is a genetic predisposition or a family history. So if you have mothers, fathers, brothers, sisters who have varicose veins, that increases the likelihood that you too will have varicose veins. Other things, I know.
Hereditary.
Well, at least it's not all you. Right? It's not something you did, it's something your parents did.
Thanks, Mom. Thanks. No. So yeah.
Absolutely. Other things that can contribute to varicose veins include history of blood clots. So deep vein thrombosis will produce varicose veins over time. And then one other less common entity, but is becoming increasingly diagnosed, is something called May-Thurner syndrome, where the left iliac vein is compressed by the right iliac artery, and that produces, again, a functional blockage and buildup of blood flow, typically in the left leg.
Okay. Oh, typically in the left leg. That's
Correct.
Interesting. Okay. All right. The next question for you. They say that they work all day on their feet, and so many people do. So many professions work all day on their feet, and they want to know if there's anything that they can do to actually prevent varicose veins from happening.
Sure. So when you're standing, walking upright for most of the day, you're basically asking your circulatory system to fight gravity to get the blood up out of the legs. So there are a couple of things that you can do. Number one, you can wear what we call Class 1 compression stockings. So these are over-the-counter compression stockings that you can get. The degree of compression is 15 to 20 millimeters of mercury, so it's just enough to help augment or push some of that blood up out of the legs. So that should prevent that blood from pooling or collecting and dilating out those other smaller veins that you'll see as varicose veins in the leg. The other thing you can do is you can look up calf pump exercises, and it will show you, there are a couple of YouTube videos out there that show you actually a couple of exercises that will increase your calf muscle pump. So the venous system, unlike the arterial system, which has the heart pushing the blood through it, is a low pressure, high capacitance system, and what that means is it requires external force, and in this case it's the calf muscles, to physically collapse those veins and push the blood up out of the legs. So if you learn the calf pump muscle exercises, you will kind of increase your ability to push that blood up out of the legs and decrease your risk of developing varicose veins.
Okay, so those beauticians that are on their feet all day,
Yep.
or nurses, or those professions, get the compression stockings and do those
And another
exercises.
exercise to add your
All right, that's great information. All right, the next question is, once you are diagnosed with varicose veins, how are they treated?
Okay.
And do you have to really be diagnosed because you see them visibly, right?
Right. So I think it's important to separate varicose veins out into two categories. So there are the cosmetic varicose veins, are the ones that you see, and then there are the symptomatic varicose veins.
Ah, okay.
So you can treat both, and it's okay to treat both, but typically I like to get a better understanding for why patients are coming to me. If they're coming for cosmetic superficial varicose veins, the treatment choices out there include sclerotherapy, which is an injection of the veins to cause them to clot off and eventually get resorbed, or to have your body take care of the veins. If they're superficial enough, sometimes you can use laser therapy to basically get rid of those veins. They're the two major options for cosmetic varicose veins. If you have symptomatic varicose veins, you have to do a couple of things. Typically, you have to, number one, identify which veins are problematic, and sometimes they can be deeper veins. And the deeper veins can be treated by a variety of closure procedures by which you're basically searing the wall of the vein closed. And then you can also treat the superficial veins, particularly if they're large, ropey, and hold on to a lot of additional blood.
When you get this kind of treatment, does it hurt your vascular health at all to do that sort of thing? Or?
So, wonderful question. So when you are closing the deeper superficial veins that I mentioned, typically it's the greater saphenous vein. That vein is one that we use for people later on in their lives if they need heart surgery. So they use that vein to do cardiac bypass. So I think that part of the importance is educating patients, looking at their risk factors, and figuring out whether they have an increased risk of needing that heart surgery in the future. And if that's the case, you may want to try and preserve one or both of those greater saphenous veins. But for the majority of people, if they have minimal risk factors and they have symptoms that really decrease or impair their overall quality of life, getting rid of that great saphenous vein really provides them with a lot of relief without much in terms of risk, because a lot of that additional blood is now being shunted into the deeper system, which has a greater capacity and typically functions normally to get the blood up out of the legs.
Okay, okay. Their next question, are there any new treatments for treating varicose veins? Anything on the horizon?
There are actually two new modalities. One is available right now, something called Claravane. So the way we are treating like the great saphenous vein is you put a catheter in the vein, you have to then inject along the vein a combination of saline and lidocaine to protect the surrounding tissue and to numb up that area. A couple of the newer therapies involve, number one, something called Claravane, which is a smaller catheter that goes in and basically serves as a kind of a revolving whip, and that whip at the end injures the cell wall, causing blood to clot in there, which is what you want to do to get rid of the vein, and then you inject an agent which also serves to further injure the cell wall, so you're getting mechanical injury as well as chemical injury. That procedure takes about 20 minutes and it's much less painful. The other new
Oh, that's great.
The other new intervention that's probably going to be out by the end of the year involves closing off the vein by injecting a little glue at the very end of the vein and then pulling a catheter back, which closes the remainder of the vein. So equal in terms of effectiveness in closing the greater saphenous vein, but much more comfortable for patients. All the stuff is done as an outpatient under usually local anesthesia. Women tend to tolerate these procedures much better than men do, for whatever reason. So at least you have that going for you, right?
We do, we have that.
But
we get more of them, so
that is true. So it's a trade-off. But the new interventions are going to be as effective, but with much less patient discomfort, and I think much better recovery times.
Again, thank you so much, Dr. Trani. And if you want to submit your questions for more Ask the Doctor segments and to even view previous Ask the Doctor segments, all you have to do is go to cbsphilly.com/CooperDocs.